Saint Laurent Centre is very busy right now hosting the Bruyère Continuing Care Radiothon that you're able to listen to on CFRA. Today on the program, though, we wanted to visit Bruyère to introduce you to some of the very dynamic people who are having life-changing and enhancing experiences here. We are here at Bruyère Continuing Care highlighting just some of what happens here. And although this is a place often associated with elderly patients, there are people here seeking rehabilitation, people of all ages, like Rob Russell. You had life change very suddenly on September 11th of this year. What happened, Rob?
I had a stroke.
When we come back after the break, we are going to share more of Rob's story and tell you how this place is factoring into his healing. Rob Russell is a 38-year-old man, a successful banker, a man leading a very independent life. And now you're just filled with gratitude that you're able to walk down the hall and talk at the same time. You had quite the shock earlier this fall.
Oh yeah, it's amazing. I can't believe that I'm actually here just standing talking to you right now. Because the first weeks of September I certainly couldn't. I woke up one morning, I was getting ready to go to work, and I was thinking I felt somewhat tired. And I went to work anyway, and when I got there, I sat in my manager's office and I got vertigo. And I'd never had it before, so I didn't exactly know what it was. So he just said, stay, relax, we'll get you some water, and all of a sudden it just left. And I said, well, maybe I should go home anyway, because I really wasn't feeling well. And when I got home, I was thinking, what is wrong with you? There's nothing wrong with you at all, right? So I lied down, and I had a nap, and in the middle of the nap, I had a stroke.
And you had the wherewithal, Rob, and this is such an amazing part of the story. You had your iPhone close by, and you ended up dialing 911 with your foot, I understand.
Yeah, it was quite impossible because at that point I got a pain through my head. Both my arms went dead, so I had no mobility from my neck to my waist. And but I felt really good. The amazing thing about the stroke is you have this feeling of bliss in some points of it. And I called 911 with my foot because I had part of my brain was saying, you know, you should call someone. You should really call someone, even though I didn't feel like it was urgent. But my brain was telling me to do it. And I called him. And I didn't sound urgent. I just said, you know what, I think something's wrong, and I think you should maybe you should drop by and kind of...
Well, you describe a feeling of bliss, but there also, when you're unable to move, there had to be, and anyone who's watching would know, the feelings of terror you must have been experiencing then and then subsequently. And as you say, you're filled with gratitude that you are able to conduct an interview and walk, and you're here as part of the Bruyère rehabilitation program.
I know, it's been fantastic here. I mean, the rehabilitation here, with the physiotherapy especially, was something that I would never have gotten on my own. And I tried physio before I got here, and it just didn't work. And here they know it to an exact science, which made all the difference to me in my recovery. I've been here for 3 weeks now, and I came in with a walker. I'm now with a cane. So it's a huge, huge turnaround from what it was.
We'll keep on walking, and we'll just show how well you are doing and how strong and filled with vitality you seem to be.
I feel great. Like I think cognitively I did really well too, and physically. And this place is what's done it for me, really. I would not be this far ahead if I wasn't here.
Well, we want to thank you so much for sharing your story. We are about to meet another man, another 38-year-old man who just is recovering. He's in the throes of recovering a stroke. This is Malcolm McMillan. Hey, Malcolm, we're interrupting your game. You carry on with your game. We're going to have Anne talk about what it is you're doing. This is Anne Taillon. And Anne, we are in what area now?
This is the virtual reality after stroke research study that Malcolm has participated in. So this is our virtual reality lab. So what Malcolm is doing here is he is having to shift his weight from side to side, forwards and backwards, in response to what the game is asking him to do. And this technology that we're using, in addition to the physiotherapy, occupational therapy, speech therapy that all of the patients get. This program that we're offering it's an inpatient study that we've been doing for the past year and a half. The patients come for 10 training sessions, and we have pre and post balance and mobility measures.
I didn't want to interrupt all of Malcolm's action there, which was really brilliant. Thank you so much, Anne. Malcolm, you were playing soccer on the screen.
Yes.
You were playing golf when you...
I was playing golf when I suffered a stroke, yeah.
Okay, let's put... You're a big, strong guy. You work in hazmat.
That's right.
And you were out golfing with friends.
Coworkers, yeah.
Coworkers.
Yeah.
What happened?
I was driving a golf cart, actually, and I lost my vision on my left side, and I crashed the golf cart.
And your friends, though, knew the sign.
Coworkers recognized the signs of stroke and called 911 right away and brought me to the Civic.
And let's talk about the process from then on. You've been here at Bruyère for how long?
I was here for about 5 weeks. I've been discharged for about a month.
And really, I was chatting with your girlfriend, and she's talked about the ups and the downs, and of course there are so many. But your recovery has really been astounding.
Yeah, it's different for everybody. To put in perspective, I was in a wheelchair about a month and a half ago. So.
Well, we want to wish you continued healing, continued success. We have Anthony and Sebastian there who are you didn't know you were going to become part of a research project, did you, Malcolm?
No, I did not.
Well, carry on with your rehab. Yes, you said you're glad to help because I guess you're just so filled with appreciation of what's happened here.
That's right.
Well, we're going to share more of the remarkable stories and the remarkable care at Elizabeth Bruyère when we come back. The Bruyère Continuing Care Radiothon is in full swing at the Saint Laurent Centre. Amy Desjardins is all things to all people. And in fact, Amy, you have spent so much time educating our community on what happens here at Bruyère, and so much. I mean, viewers will be so surprised to have just met two 38-year-old men who are successfully rehabilitated in rehab after strokes.
And that's absolutely one of the misconceptions. The other misconception is right now we're on our palliative care unit, which is the largest academic palliative care unit in the country. But the misconception is that this is a place people come solely for end-of-life care. But Leanne, in fact, more often, people come to our palliative care unit to have their pain and symptoms managed, and then they go back into the community healthy and independent. Across all of our programs and services of our 2 hospitals and 2 long-term care homes, that's what Bruyère is all about, keeping people healthy and independent and out of the healthcare system for as long as possible.
I know you have so much personal interface with the patients and with families. Families who are filled with gratitude.
It's humbling. It's humbling how courageous, especially during the radiothon season, how courageous our patients and their families are to share intensely personal stories, but they do that willingly to give back to Bruyère and to thank the staff here that really, it's over and above the call of duty. I've said over and over again to you, Leanne, that people come here, it's not just a job, it's a calling, it's a vocation.
And I'm always so incredibly surprised, Amy. In fact, we are in the end-of-life care area. And it always just amazes me how gracious your patients and clients are with their last moments. We are actually about to introduce you to Anne Mozerski, who is a woman whose legacy is in home child care and in social work. And she is here with Rabbi Arnold Fine. And I was just saying in the hallway, Mrs. Mozerski, that it's so incredibly generous-spirited of you to share these moments with us when you are at this stage in your life.
My pleasure.
You have been battling cancer since?
December 2011.
And a very, very aggressive form of pancreatic cancer, I understand?
It's a rotten disease, that's all I can say. And so I've been fighting it since December up until now. And there aren't a lot of cures for it. So I hope that with time they'll have a way of dealing with this disease.
How would you describe your time here and the care you've received?
Oh, it's been excellent. I've been here close to a month, and it's quiet, it's calm. The staff is wonderful. I just feel welcome here. The nurses are great. So I'm very calm and happy here.
You seem incredibly peaceful here, and I know, Rabbi Fine, you have many, many years, in fact, you have decades of a relationship with Bruyère.
That's true. And our family's also taken advantage of Bruyère's great facilities. My mother-in-law was a patient here about 4 years ago. I was here for about 3-4 months, and it added enormously to her life. She's gone now, but it added enormously to her life. But this unit here on the fifth floor of Bruyère is extraordinary. I had mentioned to Ann Mazursky and to others that before she came in, I said, the people who do the maintenance work here are part of the of maintaining the patient also, not in the physical sense, but in a very emotional and a very moral sense. And I just noticed when somebody came in here to empty the baskets, great big smile, and he and Ann had shared a joke. It was fantastic.
Well, I want to thank you, and as I said, I want to thank you very much for inviting us in to a room that you're clearly surrounded by love, and I wish you peace.
Well, thank you, and thank you for publicizing this wonderful institution. More people need to know about it.
Welcome to the Day Hospital here at Bruyère Continuing Care. It is such a pleasure to introduce you to Betty Eli, who is 99 years young, and you're here for a very simple, or at one time what was a simple exercise, but you're here learning how to fluidly do what, Mrs. Eli?
I'm learning how to walk properly after an operation, a hip operation. I broke my hip.
And also how to get in and out of the bathtub safely and comfortably, from what I understand.
Yes, and how to walk properly.
And you are 99 years young, from what I understand, and we're squeezing this interview in before you have to run off to another appointment. Now, I wanted to offer a little bit of context in terms of your history. You had a very prominent, a very high-profile job. Our viewers would be interested to know what you did to earn a living.
Well, I didn't do much through my life, but my husband died at 45, and so I worked for John Diefenbaker as his private secretary for the last 10 years of his life.
You were very, very active in the most high-profile office in the country for 10 years.
Well, one of them, yes.
Now, I have to ask you, because everyone does, the secret to your youth.
Well, I tell everybody that because I have gained this great youth, I have drunk 2 bottles of scotch a day, and that has kept me young.
Now, no one really believes you, but it's a story that you're sticking to, isn't it?
Absolutely.
Oh, well, we want to thank you so much. What would you like everyone to know about this facility?
I think it's a wonderful place. It's helpful. The people are very kind. I think it's extraordinarily helpful to many, many people.
All I want to do is take some time a little bit later to find out everything you really do to be so active and engaged at 99. I want to thank you so much. We're going to head on out to meet Mrs. Cynthia Steers, but first I wanted to connect with Dr. Shamji. Dr. Shamji, this is an interesting area that is sort of an apartment of sorts.
Yes.
We just met the dynamic Mrs. Eli.
Yes.
You have the best job, I'm sure.
I do. I absolutely do. We get to look after the elderly in our community and help them to really get back to their home and be as independent and safe as they can be.
Well, we want to thank you for the work you're doing and introduce someone else who is most appreciative of having those skills. This is Cynthia Steers, mother of 4, grandmother of 5, and isn't it great when you're sharing a space with a 99-year-old? Don't you feel like a spring chicken at 82?
I do.
And so I did. I just hopefully gracefully gave away your age of 82. Okay. You've been very active until you had a couple of falls.
Yeah, I had several falls actually. The one that was the worst, I guess, left me with 4 more fractured bones in my spine, and that kind of laid me low for about a year.
But now you're regaining strength and coordination, and how would you describe to those watching who've never actually been into this facility what happens here?
Oh my God, everything. No, seriously, if I may say so, I think this place is a pattern for all the seniors coming along behind me. It's an interdisciplinary approach. There's a physio and an occupational therapist, doctors, nurses, all the help you can possibly imagine.
And has it helped with your confidence?
Oh, superbly. Yes, it has. Yes, they're great, great people.
Well, we want to thank you for sharing your time with us. And of course, you can listen on CFR Radio throughout the day to the Bruyère Continuing Care Radiothon. But we had to pop by here to introduce you to some of the very appreciative recipients of the care. Thanks so much.
Thank you.